In the public, the abortion industry always claims that any restrictions on abortion jeopardize the health of women. But what do they say when they don't think anybody's listening? Life Dynamics researcher Mona Pasignano has the answer to that question. What's going on here, Mona?
Well, I'm just going to let you hear some clips from some National Abortion Federation conference tapes. The first one you're going to listen to is from April 24th through 26th in 1994. It was held in Cincinnati, Ohio. And the lady you're listening to is a clinic director from Toledo. And hear what she has to say.
And I actually started to think that the 24-hour delay is actually giving us another gift, in that when we see rape and incest and domestic violence survivors in the clinic ahead of time and can identify them, we have more time to work with them.
Okay, well, she doesn't seem to think that there's a lot of problem, apparently.
Well, and in fact, she says, if you listen to her, rape and incest victims are the ones that benefit the most. Well, they're always the ones, the pro-aborts are always the ones screaming that we do this because of the rape and incest victims.
Right, exactly.
So this regulation actually helps them the most. Let's listen to that same conference, but it's a different session, and it's a different woman. And she's from Columbus, Ohio, and let's hear what she has to say about it.
So by the time they come back the next day, 2 days, week, whatever it is, there is a little bit more of a comfort level. And it's made us a little bit more like mainstream medicine, believe it or not, that you would see a physician and for more than once if you were discussing surgery or whatever. So there's a little bit of an increase in the comfort level.
Okay, so they're agreeing that the women who do come back are more comfortable about their decision, that everything's...
It's mainstream medicine. This is how it would happen if you had another type of surgery.
Right.
That's exactly right. So this actually is helping women so far. We know that there's some other regulations, though, that help women, and this next one is from 1991. It's from a National Abortion Federation conference. It's April 28th through May 1st, and this woman that's talking is from Massachusetts.
Well, I guess I would say I am convinced. It is a good thing to remind them to have some other adults involved in this whole process of going to get an abortion. I don't think it must be a parent, I don't think it must be a relative. I think that we've seen so many of them who are turning out to be a positive experience. But I don't like the law.
All right, so now what we're saying is that not only do adult women profit from a little restriction on abortion,
right,
minor girls do.
This is very good for minor girls. And you heard what she said. I don't like the law.
Right.
And that's going to bring us to our last clip, because this is the whole crux of the matter. It's not that this hurts women, it's that they don't like it. And this next one is from the National Abortion Federation Conference in '94, and this is Joan Coombs, who is the Executive Director of Planned Parenthood of Southern Pennsylvania.
Logistics. Anything new is a nightmare for your staff to implement. We all know that. But it's more so when your staff is implementing something that offends their sensibilities and yours, and it brings a really different overlay to it.
Okay, so now the cat's out of the bag. We know what the real agenda here is.
Right.
It's when they come out here and say that restrictions on abortion harm women, they're lying. What they really are saying is restrictions on abortion harm us.
It makes it hard for us. That's
right.
exactly
They
right.
want to be in control.
And that's what Joan Coombs goes on to say in this transcript. We can't let you hear it because we don't have enough time. She goes on to say, we don't like being out of control.
Right. So the issue is not protecting women. It has, and we see this as a common theme through everything that we cover on the abortion industry. The issue has nothing to do with protecting women. It has to do with protecting the profit that those women can bring into the abortion clinics. It has nothing to do with protecting these women.
Right. That's correct. And then we have Catherine Colbert from the Center for Reproductive Law and Policy. She says everything else, she's talking about all the restrictions, everything else is annoying. Everything else is extraordinarily paternalistic.
Now, who is this?
This is Catherine Colbert, the attorney, one of the Center for Reproductive Law and Policy, that is one of their main attorneys that always goes into court to fight all of these regulations at the state level. She says it's just annoying.
For them.
For them.
Not for the women.
Nothing else. It's annoying.
Right. Great report, Mona.